Shoulder osteoarthritis. The glenohumeral joint is the joint where the head of the upper arm bone meets the glenoid. It is responsible for the shoulder's wide range of motion. In a healthy shoulder, the humeral head and the glenoid are covered by slippery cartilage that allows the bones to glide smoothly against one another while arm motion. Shoulder osteoarthritis is a common name for glenohumeral osteoarthritis. It is a condition that involves degenerative changes to the cartilage and other structures in the glenohumeral joint. The gradual loss of cartilage eventually causes the two bones to grind against each other, which can cause pain, stiffness, and inflammation in the joint. This bone-on-bone friction can lead to the development of bone spurs called osteophytes. The normally rounded surface of the humeral head may also begin to flatten out. In shoulder joint arthritis, the shoulder may catch in the middle of a movement. It may also emit popping sounds or crunching sensations, crepitation. As glenohumeral osteoarthritis progresses, part or even all of the shoulder's normal range of motion may be lost. Causes. Shoulder osteoarthritis can be either primary or secondary. Primary osteoarthritis has no specific cause but is related to age and sex. It is usually seen in people over the age of 50, and women are affected more often than men. Secondary osteoarthritis. It may happen because of previous injury such as intra-articular fractures or dislocations, joint infection, or rotator cuff tears. Symptoms. Pain. Pain is aggravated by activity and gets worse over time. As the disease progresses, the pain will continue when you are at rest and will begin to interfere with sleep. Limited motion and stiffness that makes it difficult to do everyday tasks. Crepitus. Hearing and feeling grinding and clicking noises as you move your shoulder. Diagnosis. To diagnose shoulder osteoarthritis, your doctor will ask about your symptoms and medical history. He will do a physical examination to assess pain and range of motion and to look for other signs in the shoulder. Your doctor will likely order X-ray. In case of osteoarthritis, it will show joint space narrowing, changes in the bone, and the formation of bone spurs. He may order blood tests to exclude other diseases which may cause or associate the shoulder osteoarthritis. He may order MRI scan to evaluate the rotator cuff muscles and tendons. Treatment. Initial treatment may include analgesics and non-steroidal anti-inflammatory drugs, NSAIDs, which reduce the pain and inflammation. Physiotherapy can help by stretching and strengthening the shoulder muscles. Platelet-rich plasma therapy, PRP. The platelets contain growth factors which are important in the healing of injuries. With a high concentration of growth factors, PRP injections support the restoration of injured tissue and inhibit painful inflammatory processes. Depending on the grade of osteoarthritis, 2 to 6 injections may be required, performed at weekly intervals. Stem cells injection. It can decrease inflammation, stop the progression of arthritic damage, and may repair damaged joint cartilage. Stem cells are harvested directly from the patient's body from the fat of the abdomen or from bone marrow. Intra-articular steroid injections can reduce inflammation and provide short-term relief. Suprascapular nerve block may be indicated for relief of chronic shoulder pain due to osteoarthritis that has failed to be relieved with conservative treatments. The pain relief can last a few weeks to a few months. Steroid used to nerve block can take up to 2 weeks to begin working. Sometimes it does not provide any relief at all. It depends on the patient. The treatment of choice for advanced glenohumeral arthritis is surgery. It is indicated for osteoarthritis when conservative do not help relieve pain. Total shoulder replacement. The surgery is performed under general anesthesia. The upper arm bone is separated from the glenoid socket of the shoulder blade. The arthritic or damaged humeral head is cut. The glenoid socket is prepared and the plastic glenoid component is fixed in the shoulder blade. Prepare the humerus bone and make it hollowed out. A metal ball with a stem is gently press-fit into the prepared humerus. Reverse total shoulder replacement. It is an alternative surgery for patients who have massive rotator cuff tear or who have had a failed previous total shoulder replacement. In reverse total shoulder replacement, the placement of the artificial components is essentially reversed. In other words, the humeral ball is placed in the glenoid cavity of the shoulder blade, and the plastic socket is placed on top of the arm bone. This design makes efficient use of the deltoid muscle in order to compensate for the torn rotator cuff. Fusion is the best solution for a few selected individuals with really bad shoulder problems. Shoulder fusion may be considered for really bad resistant infections, paralysis, or severe instability. It can also be considered after catastrophic failure of shoulder replacement, post-shoulder arthroplasty rehabilitation. You may be discharged home on either the first or second postoperative day. Upon discharge from the hospital, you will visit a physical therapist who will begin the postoperative therapy program and show you some exercises for home. Use your sling during the first 6 weeks to protect the shoulder arthroplasty and to ensure wound healing. Initially, you are allowed to move only the elbow, wrist and hand. Pendulum exercises. You gently swing the hand forward and backward, then side to side, and then clockwise and counterclockwise. Physical therapy will be recommended to strengthen the shoulder and improve flexibility 2 weeks post-surgery. You can drive after 8 weeks. Return to physical activity and sports after 3 to 6 months.